One of the last great film industry taboos is admitting to having work done. Whether it's just a little jab of Botox or a more severe cosmetic procedure like breast implants or a facelift, stars have long since been going under the needle and the knife in complete denial. But times are changing, and a handful of brave celebrities are opening up about their experiences, both good and bad, with plastic surgery and cosmetic injectables. But sometimes you do think it's a little bit unnecessary. Well, here are 10 most unnecessary facial transformations that people love. Number 1. Kybella. Depending on the provider's expertise, a Kybella treatment won't go as planned and can end in potential risks or medical complications. As with any cosmetic procedure, there is a big selection of variables that make sure that your provider is very trained and qualified. Yet, as cliché because it may sound, mistakes happen. A Kybella treatment consists of placing an injection template under your chin to understand where to inject. Inexperienced providers may improperly place the injection template, leading to a botched Kybella treatment. An improperly performed treatment may result in asymmetrical, uneven results and medical complications like constant swelling and pain. Number 2. Lower facelift. Not all facelifts are created equal. A facelift may be a highly custom procedure tailored to the individual. There are many various surgical techniques available to deal with a variety of aesthetic concerns. These days, a facelift is more of a loose term for a group of surgical facial rejuvenation procedures. A lower facelift may be a smaller amount invasive than a full facelift and helps minimize pain, side effects, and scarring. Many patients are pleasantly surprised to seek out that they will achieve a more youthful-looking appearance with a lower facelift. The procedure addresses rock-bottom third of the face, which is usually quick to point out visible signs of aging. The procedure is during a position to correct deep wrinkles, facial creases, and lax skin that contribute to jowls and a fleshy neck. Lower facelifts are done by our board-certified surgeons with a little easily concealable incision under general or local anesthesia. Over the course of 1 to 2 hours, your surgeon will remove excess skin and tighten underlying muscles, restoring your face to a younger position. The corners of your mouth also can be raised, supplying you with a naturally well-rested and happier appearance. You'll be ready to head home on the equivalent day of your procedure. Because your surgery requires general anesthesia, you'll need someone to drive you and stick with you a minimum of 24 hours post-op. Most men and ladies prefer to return to figure 1 to 2 weeks after their lower facelift. However, it can take several weeks to be fully healed. Results from your lower facelift should be noticeable soon. Skin will appear firmer, smoother, and more contoured. As post-surgical swelling and bruising subsides, an optimal outcome will begin to emerge. A lower facelift can take the maximum amount as 10 years off your facial appearance. Number 3. Eyebrow lift. 2 types of brow lifts. There are 2 methods to lift your forehead and eyebrow areas. Classic lift. Endoscopic lift. The classic lift involves one continuous cut beginning at the extent of your ears and rising around your hairline. Depending on where your hairline is, the surgeon will work to avoid a clear scar. For the endoscopic lift, the surgeon makes a few shorter cuts in your scalp. They will insert a scope, a little camera on the top of a skinny tube, into one among the cuts and use another device inserted in another cut to make the necessary changes. In the endoscopic lift, the surgeon uses small anchors to secure the tissue. Because the cuts are smaller, this procedure is a smaller amount invasive than the classic lift. You will have minimal scarring and a shorter recovery time. Number 4. Ear pinning. Ear pinning is surgery to correct protruding ears. Ear pinning may be a sort of otoplasty or cosmetic surgery on the external ear. Your surgeon may have to get rid of cartilage and skin behind your ears and can use permanent sutures or stitches to pin back your ears. Most people seek ear pinning for cosmetic or aesthetic reasons. Ear pinning may be a common surgery with risks and potential complications. Consider getting a second opinion about all of your treatment choices before having ear pinning. Number 5. Rhinoplasty. Rhinoplasty is surgery that changes the shape of the nose. The motivation for rhinoplasty could also be to vary the looks of the nose, improve breathing, or both. The upper portion of the structure of the nose is bone, and thus the lower portion is cartilage. Rhinoplasty can change bone, cartilage, skin, or all 3. Talk with your surgeon about whether rhinoplasty is appropriate for you and what it can achieve. Rhinoplasty can change the size, shape, or proportions of your nose. It may be done to repair deformities from an injury, correct a congenital anomaly, or improve some breathing difficulties. Chin implant or chin augmentation are often performed by using medical-grade silicone or Gore-Tex implant approved by the US FDA. The silicone implants are often placed through an intraoral incision or through the face skin, submental incision, approaching under the chin region. Chin augmentation also can be done by subtracting bone from the chin region alongside sliding your bony chin to either decrease or increase the facial height. Bony parts are secured with screws and titanium plates, a kind of orthodontic surgery. What's the fabric the implants are made of? Chin implants are often made from bio-non-integrable bioinert material like silicone or biointegrable material like porous polyethylene. Silicone is softer in contours to the cheekbone better. However, chances of implant extrusion could also be higher. Porous polyethylene implants like MetPer are stiffer, provide a higher contour to the chin, and get integrated with the body tissue, but are costlier. Generally, it depends on the surgeon's choice, as all kinds of implants have pros and cons. Number 7. Lip fillers. Lip augmentation may be a cosmetic procedure which will offer you fuller, plumper lips. These days, an injectable dermal filler is the most ordinarily used method of lip augmentation. There are many sorts of dermal fillers which will be injected in your lips and around your mouth. But the four most common fillers today are products that contain substances almost like mucopolysaccharides. Mucopolysaccharides may be a natural substance found within the body. It helps increase volume in your lips. These sorts of dermal fillers are sometimes called hyaluronic acid fillers. Collagen, once the foremost common dermal filler, is employed less often today. The newer options are safer, and therefore the effects last longer. Number 8. Botox. Botox may be a drug that weakens or paralyzes muscle. In small doses, it can reduce skin wrinkles and help treat some medical conditions. Botox may be a protein made up of neurotoxin, which the bacterium botulinus produces. This is often an equivalent toxin that causes botulism. Botox may be a toxin, but when doctors use it correctly and in small doses, it can have benefits. It's both cosmetic and medical uses. As a cosmetic treatment, Botox injections can reduce the looks of skin wrinkles. Also, the Food and Drug Administration, FDA, have approved it as a treatment for various health issues, including eyelid spasms, excessive sweating, some bladder disorders, and migraine. However, when Botox is appropriately utilized in a therapeutic context, it's safe and has few side effects. The American Osteopathic College of Dermatology report. Manufacturers make Botox injections with very small doses of neurotoxin. The drug can temporarily paralyze muscles, which may benefit people with various muscle or nerve disorders. Number 9. Dimpleplasty. A dimpleplasty may be a sort of cosmetic surgery to create dimples on the cheeks. Dimples are the indentations that occur when some people smile. They're most frequently located on the bottoms of the cheeks. Some people can also have chin dimples. Not most are born with this facial trait. In some people, dimples are present from indentations within the dermis caused by the deeper facial muscles. Others could also be caused by injury. Regardless of their causes, dimples are regarded by some cultures as a symbol of beauty, good luck, and even fortune. Thanks to such perceived benefits, the amount of dimple surgeries has increased significantly in recent years. Number 10. Smile lift. Many of us have a particular frown upon their faces when their mouths are at rest. Smile surgery actually lifts the corners of the mouth to assist them avoid this look of being disgruntled or unhappy. It's generally performed by plastic surgeons and may permanently change a person's expression from angry or sad to a more pleasant look. While many of us confuse a smile lift with a lip lift, they're technically different. A lip lift doesn't address the corners of the mouth, while a smile lift focuses only on the space between the bottom of the nose and therefore the upper lip. I hope you enjoyed watching the video. And if you do like it, don't forget to comment, like, and share this video. Let us know your views in the comment section below. Until the next video, stay tuned and subscribe to our channel for more uploads like this. Also, don't forget to hit the bell icon.